Hello, I'm Dr. Vijay Murthy. I'm a functional medicine doctor based in Harley Street. I'm trained as an Ayurvedic doctor and naturopath, and I also have a doctorate in public health. So, obviously, because of all of these different disciplines of health, it's always intrigued me what goes on in the media about health trends and to debunk those myths as well as to share with you the right information. And so, this YouTube podcast, I hope you will find the thoughts that I'm going to be sharing with you, the information I'm going to give you, and possibly some of the insights that is going to come through these podcasts that are based on my clinical experience and, more importantly, my own personal experience with journey through health, and that it will put you in the right path to consider your own health. I'm always intrigued by what trends in the media. For example, a few days ago, I was interviewed by the Evening Standard for commenting on, is oat milk bad? Is it unhealthy? Because you will have come across this news which is really making rounds, especially amongst those who are interested in monitoring their glucose levels, like myself. And should we go for a plant based milk? Those who have ditched the dairy based milk. I mean, I don't drink dairy milk, not because I think dairy milk is all bad news, it doesn't suit me. Whereas I have taken up plant milk, I have done soya milk for several years, and then I switched to oat milk. And now, the news after this very popular book, The Glucose Goddess by the French biochemist, oat milk is receiving a lot of criticism. So it obviously, even for someone like me who has such extensive exposure to scientific literature on nutrition and clinical experience, because day in and day out, I see patients who come to me with digestive disorders, food intolerances, food sensitivity, and allergies. And I start to question myself, okay, after reading the Glucose Goddess book and the news that it's making, I had two thoughts. Should I be ditching oat milk, or should I actually look into what is the truth behind the trend of promoting one type of food, in this instance, one type of milk, and criticizing another type of milk? Obviously, this can be very confusing. So, let me in this podcast share with you, when you meet such intersections where you have to either turn right or turn left, am I going to have oat milk, or am I going to now choose hazel milk or cashew milk if you're drinking more plant-based milk? And let me share with you, I'm not vegan. I eat largely plant based because vegetables, fiber are so important. And most of my carbohydrates, I must admit, comes from vegetables. As I've found that eating too much grains, especially for me, with my very strong family history of type 2 diabetes, and me being in my early 50s, it's actually difficult when you have a close family relative or close family relatives who are diabetic to control sugar levels. Hence, I pay a lot of attention to how my glucose levels, it varies depending on what kind of food I take. Of course, if I go back to my foundational uh, years of medical training where we learn about glucose metabolism, it's very clear that whenever you eat a food which has any amount of carbohydrates, it is going to spike your sugar levels because that's physiological. Let's say, for example, I have a handful of rolled oats. Because it's largely carbohydrates, the moment it starts to get digested, as carbohydrates, they get digested more readily and faster than proteins and fats because there is quicker gastric emptying. Through the gut lining, the glucose starts to enter into the bloodstream. And once the glucose levels rise in the bloodstream, then the pancreas, the beta cells, which secrete this hormone called insulin, that's responsible for controlling the glucose in blood, it also starts to become activated, it's secreted, and it tries to regulate the glucose levels by pushing the glucose into the cells, mainly the muscles, let's say, and excess glucose is then pushed into the liver where it is stored as glycogen. So, this way, we have a very tight control of glucose in the blood, and this is dependent on the kind of food that we eat, the quantities of those foods, and what we must not forget is it also depends on your own metabolic type. So, in someone like me who has a strong family history of type 2 diabetes, I could be having, let's say, a bowl of homemade granola with, let's say, I just add some water to it. Obviously, the sugar levels they start to spike within about 15 minutes. And physiological, like the sugar levels after eating carbohydrates, by 15 minutes, it starts to get released into the bloodstream through the intestinal wall. So the sugar levels are going up. And now the insulin's function is really to push excess glucose into its safe respective places, the muscles, the liver, the tissue. In about 30 minutes, the sugar level further spikes, and it is at 60 minutes that the sugar spike reaches its peak. After 60 minutes, then insulin would have acted on this glucose, so sugar level starts to drop. By about 90 minutes to 2 hours, sugar levels will be normalized or optimized. So if you're not diabetic, then it could be anywhere between, let's say, 4.5 to 5.9. And if you are pre-diabetic, it could be a little bit more than that. If you are diabetic, either you are controlling it through diet or you are on medications, it will be a little bit higher. Of course, you can look up what are the acceptable sugar levels for non-diabetics, pre-diabetics, and diabetics. But basically, what I'm trying to say is, sugar spiking and it coming down to its normal is a physiological process. But how quickly it happens and how much it spikes is dependent on many different factors. For example, let's take the example oatmeal. Of course, it's a liquid, and liquids are very easy to get through the digestive tract. So, if you're drinking oatmeal, particularly commercially made oatmeal, then it may have added sugars, which is quite common to make it tasty. And it is carbohydrates and it's in the liquid form. So it gets into the bloodstream much more quickly. But then can we then say, oh, oats are bad? No, because if you have, for instance, this morning I had my brunch which just consisted of two poached eggs, and there was some yogurt. And then, because my partner was having this lovely granola with seeds and nuts and yogurt, it also had some raspberry jam. I wanted to try a bit of it, so I took not so much the jam at all, but just the part from where there was this granola and nuts and seeds. It had this lovely spices like cinnamon. I think it had a little bit of ginger, and just about a spoon. And then I do monitor my glucose levels. I must say I monitor my glucose levels not because I think I have to really be very careful about what I eat, but the fact that I monitor my glucose levels motivates me to eat well. So I am not going to eat something which is highly sugary or having a sugary drink. For example, a couple of days ago, I was at a book launch, and there was this beautiful Indian chai that was served there. And it was made of all natural ingredients. Like there was no refined sugar used. They had used what is called jaggery, which is a form of sugar. But because this Indian chai always only tastes good if you have some kind of sweetener, particularly jaggery, which is traditional in India. Oh, it's sugar. I had a little bit of that, and then I checked my glucose levels. It really spiked. Clearly, because I'm having a liquid that's mixed with, even if it's natural sugars. But I could have freaked out. It came down. It came down within 30 minutes. So just to kind of think that, oh, I have had some oat milk or I had some chai and my sugar levels are going up, so absolutely I have to ditch this, I don't think is a very sensible approach, because we are then going to be depriving ourselves of nutrients. We're going to develop eating disorders. Yes, it's very important that you try and manage a certain pattern of glucose levels where your graph does not have too many peaks and troughs, but is more regularized. But that should not be just dependent on uh, demonizing one food or by putting another food on the pedestal. That, if you have this particular food, like good protein, and that's all you need, your sugar levels will be normalized. That's not a very good approach. We need to understand that every kind of food that we eat has a certain impact on sugar. That's where it's good to inform ourselves of the glycemic index and glycemic load. Again, glycemic index and glycemic load, they're not the same. Glycemic index is foods are classified as high glycemic, medium glycemic, or low glycemic, from 0 to 100. And it's better to consume low glycemic or medium glycemic foods, because that indicates the rate at which the glucose rises in the blood when you consume a food. More importantly, it's the glycemic load. What is it going to do to your blood glucose, which is the ultimate impact, the glycemic impact? We can manage the glycemic impact or the glycemic load very cleverly. This is where it's always good to eat foods which are a combination of whole grains or non-refined carbohydrates, proteins, and fats together. When we do this, we are slowing down the release of glucose in our system. That's why, when you are in a rush, like myself, when I'm on the way to the clinic, I go to these cafes, sometimes to get a cup of coffee. I like to start my day with a cup of coffee. I find it beneficial, useful for me. But it's very tempting also when you look at all of these croissants and this Bircher muesli or other healthy labeled, attractive looking granola with some acai berry and some jams or with mango. It's all labeled healthy, but you want to make sure that you're not going to be tempted to have something which is going to have high glycemic index and high glycemic load. Instead, if you actually go for a handful of nuts, which is largely fats and proteins, and of course the carbohydrates in nuts as well. But because of its combination of carbohydrates, proteins, and fats, the release of glucose will be slow. That's what we need to think of, is how well can we control the release of glucose by choosing the right kinds of food combinations. If we look at traditional societies, there's no such thing as you just drank one drink or you just had one ingredient or two ingredient meal that's going to be a major part of your eating. All traditional cultures, they go for variety. So obviously the key is really having that variety. It's not just about picking one food and saying, oh, this is bad and it's got high glycemic load or it has got bad press, so I'm going to ditch it. It's the mono diet culture, or putting one food on the pedestal because it's making news and another food is really evil to you, completely ditch it, is where we can go wrong. As a normal consumer for me, or even as a doctor, I'll have to be very careful about how I choose my food. So I go for variety, I go for complexity of food, because food is the language that our body understands. Like in functional medicine, we say that food is code. It's like a software. It is a code, and it is going to have an impact on all of our biochemical processes. And imagine if your code is just very simple, one instruction code, you can't expect a complex output or to resolve a problem which needs quite complex coding. So make your food not complicated but complex by simply using carbohydrates, proteins, and fats. And if you're somebody who is interested in measuring your glucose levels, like myself, from time to time, do watch for the curve. If it is within that green, then you're eating well. You don't have to then just go by uh, looking from a microscopic perspective at a granular detail. Which food should I choose? Which food should I not choose? Because it's very easy to develop these obsessions and then to have an eating disorder. So really, our choice of food has to be wholesome, it should be natural, it should have variety, let it be complex, not complicated. And if you're trying to be active as well, then you don't need to worry so much about knowing the glycemic index, the sugar spiking of every food. Let's not become obsessed with these trends. Let's be logical, scientific, realistic, and lead a healthy, happy life.